All right, if you're ready, I'm starting the timer. Here is the timer, and here is the question. So if you've read and understood, kindly begin your examination.
So I will wash my hands. I will introduce myself. My name is Dr. Mavish. I'm one of the surgical candidates today. Can I confirm your name and your age, please? So
Yes, I'm Anna, 40 years old.
Okay, nice to meet you, Anna. So today I'm going to examine your back, and then that involves me in looking at it, feeling it, and asking you to move in certain directions. And also, I would be doing the same with your legs. Do you have any pain anywhere?
No,
Okay.
not
Are you
that
happy?
much.
Are you happy for me to proceed?
Yes, please.
Okay, and then the exposure the patient should not be wearing other than shorts, and the the position initially should be standing, and then according to the examination the position will vary. I will start with the inspection of the spine. So inspection of the spine, I would be looking at it from all the sides, and when I'm looking at it, I will be looking for lumbar lordosis, any scoliosis, any kyphosis. I would be looking at any scar marks, any muscle wasting, any other deformities, and I would be looking for the tuft of hairs onto the lower lumbar spine. I would also be looking for if there is any swelling, if there is any crutches behind by the patient's side present. Then I would be after I've done this, I would start the palpation. So the palpation, I would first of all check the temperature of the patient's spine by
Yes.
touching it with the comparing it the other side. Then ask the patient that I'm going to go to the back and start for the palpation. And if they have any pain, they can let me know, and I will stop if it is very uncomfortable. So I will start by palpating the cervical spines, and then coming down, I would palpate all the spines of the thoracic and the lumbar vertebra. Then I would if there is any positive finding, then I will start the palpation of the paraspinal muscles, and I will start from the neck, and then I will keep on palpating in a step ladder manner, and will come down to look for any pain on the on the muscles of the back. Then sorry, then I will ask the patient that I'm going to now ask you to do certain movements to look for the movement of the spine. And to begin with, I will ask the patient to touch their chest with their chin, and then straighten it back again. Then I will ask them to touch to their right shoulder with their head, and then to the left shoulder with their head. This will be checking the movement of the cervical spine. Then I will ask the patient to fix their hip joint, and then move their trunk to the first left side and to the right side to check for the thoracic spine. And then I would ask the patient to bend and touch their toes to check for the lumbar flexion. Then ask the patient to straighten up, and then I will put a hand onto the patient's hip and ask them to bend backwards to check for the extension. And then I will ask the patient to move side to side for the lateral flexion. So this completes the movement of the spine. And now I would do special test for the spine. So for this, I would first do the straight leg raise. I will ask the patient to lay down and be comfortable, and then I will ask the patient to raise their leg as much as they can, and then I would dorsiflex the foot, and the patient will have pain onto the back of their leg. This is positive for this sciatic nerve compression or the impingement. This is a straight leg raise test. Then I will ask the patient to turn towards their prone position, and then I would ask the patient to flex their knee, and then I will extend their hip joint and plantar flex the foot, and the patient will feel pain onto the anterior thigh. This is called the femoral stretch test. This is for the femoral nerve impingement or the stretching. Then I would do two tests to see if the patient has ankylosing spondylitis or not. So the first test is called the Schobar's test. I will stand behind the patient's back by asking the permission, and then I will palpate posterior superior iliac supine, and then I will point in between, make a dot in between that, and 10 centimeter above and 5 centimeter below, there will be 2 more points. I will ask the patient to flex and touch their toes, and I will measure the distance between these 2 points. If it is more than 20, it is normal. If it is reduced, that means the patient has ankylosing spondylitis of the back. The second test is the extensor expansion test. I will ask the patient to take a deep breath in and hold, and I will measure, and ask the patient to do the same when they are expiration. Then I will measure the difference between them. If it is less than 2.5 centimeters, then it means that there is ankylosing spondylitis. This finishes off my special test for spine. Then I will ask the patient, I'm going to examine their legs now. So to begin with, I would first of all check for the tone. So for the tone, I would first ask the patient to straighten their legs, and I'm going to roll the legs. If they have any pain in the hip joint, they can let me know. And then I will move both the legs, and I will see the floppiness of the foot. If it is more floppy, or if it is normal, if it is not very mobile, then I will ask the patient to bend their knee and at the 30-degree flexion, and I will lift the knee, quickly lift the knee and then drop it, and then see if the patient's heel lift off the edge of the couch, and do the same on the other side. Then I would check the ankle clonus. In the ankle clonus, I will hold the patient's foot into the with the heel, and then I will do sudden dorsiflexion, plantar flexion movement, and then see if it is more than 5 asymmetrical movement. That means the ankle clonus is positive. Then I would check.
Can you present your case now?
So the patient is I've seen this patient is 40 years old patient who came with the complaint of back pain. On examination, there was an inspection of the spine was normal, and the palpation was a tenderness over the lumbar spine and over the lower lumbar spine, and then on the movement there was reduced movement of the flexion and the extension of the lumbar spine. And on the special test, patient has positive straight leg raise test. That is the diagnostic straight leg test. And the tone.
So what are your differential diagnoses that you are going to consider?
So my differential diagnosis in this patient is either sciatic nerve impingement, L5 S1 root impingement, or it is the L4-5 disc herniation the patient is presenting.
Anything else? Because I said differential diagnosis.
So the differentials, other differentials could be either could be the vitamin D deficiency, could be peripheral neuropathy, could be a combined degenerative.
What are the images that you are going to ask for?
I would like to have an X-ray of the spine and an MRI of the spine.
What should be the management or treatment?
The treatment, the conservative treatment includes the physiotherapy, exercise, analgesia, and then if it doesn't work, then we might have to do the laminectomy and discectomy plus minus laminectomy for the patient.
According to your opinion, what was the neurological status of the patient?
So the patient would have the would have the decreased sensation on the L5-S1 nerve root, and then these are the findings that would get.
Good, well within time. And my request and for you, when bell goes, even if you are not done with the examination.
Okay, I'll stop. Yeah. Okay.
Yeah, and turn to examiner and present. So would there
Okay.
be anything that you would want to do to complete your examination?
So I would like to do the examination, a complete neurological examination of the both lower legs,
Yes.
and also
This
if
you
there's
have to say when you present your case, then you can say, okay, I've
okay,
examined this,
yeah,
and
okay,
I would like to complete my examination with,
yeah,
yeah. And then when you're giving when you're telling differential diagnosis, then you don't have to say the long sentences. You can just name them 1, 2, 3, like
yeah,
bullet
okay,
form or point form or just the names. Okay.
okay,
Yeah, this will save milliseconds. The more
yeah, okay,
questions you will answer, the more marks you will get.
yeah.
So these are the small things we have to work on. Very good. So who wants to give feedback to Dr. Mavish? Yes, Dr. Abhishek? Anyone? Excellent, yes.
No, actually, she did really well, ma'am. But there, I had some doubt about the special tests. I think she
Shobers
should
you
not
do? Yes.
show what she did actually, and we also do the LASIK sign, bracket sign, and something like a favor test. So I think if there is any time scarcity, so we can
If
avoid
time
this.
allows,
Yeah,
otherwise
yeah.
at the end she
It's a
can
very
say,
big examination. Yeah,
yeah, it's very long.
yeah,
And
yeah,
that's why I interrupted her, because day after tomorrow she'll be giving exam,
yeah, yeah.
and
It's
then
really okay.
this should come in her mind that if she's not done, she should stop there, turn to the examiner and present it.
Yeah,
Leave
okay.
everything behind.
Yeah.
At last,
Otherwise,
wash your
this is,
and thank the
yeah.
patient, or you should
Yes, she
say.
forgot that
Yeah.
Sorry,
at the
what?
end.
Wash my hands
To wash your hands, thank the
and thank
patient,
the patient.
ask
Yeah,
the patient to cover themselves,
yeah. I've
Say
been
this
and
practicing
word.
then
all day in this way, but then I was like, okay, I'm not allowed to present such. Yeah, I will do it in the exam
It
for sure.
it happens. It
we'll make
happens.
sure we check it tomorrow as well.
Yeah, you do make sure that I'm doing it.
We make sure we check it tomorrow as well, because this you should have on your tips.
Yeah, I am very bad in keeping promises. Yeah.
But
We'll
like
try. We'll
this is a
see.
very small point, but it will must keep one
Yeah,
or two
yeah,
marks definitely.
It
So
definitely it does.
exactly.
It does.
yeah, yeah,
It carries a mark,
yeah, of
I
especially
will.
in
course.
COVID. Don't expect them to ignore washing hands. So just keep this in your mind.
Yeah.
All right. Anyone else want to add anything? We have so many members. Anyone else want to say anything? Maybe Dr. Ali Umar.
Dr. Mawish, did you check the gate?
She mentioned in the beginning, but then she
Oh,
didn't.
okay, okay, okay. Yeah,
She said she
gate is
will
very
check.
important. Yes,
Yes. And walking aids and all that she mentioned
all that.
in the beginning. Yes. Yes. Anyone want to say anything? Yes, there are.
Dr. Mohammad Zaid, we will have to examine the spine first. Then we will have to go to the
Yes.
lower limb. You have to do that. You can omit cervical spine. You can do the thoracic and lumbar one, but you have to
Yeah.
take the temperature, tenderness, chest expansion, for ankylosing spondylitis, Trovartis. These are very important. The movements.
Can't go ahead without them. Yes. Anyone else want to comment or give feedback or remark or any good suggestion? Because she will be appearing in exam, so it will help her. Any positive, negative criticism, something which she can help to improve herself.
I think, hello, Dr.
Yes.
Marvish, you did really, really well.
Yes.
It's just that, like how ma'am interrupted you in the thing, you just have to keep a bit of, your time. You have to distribute your time. You have to give time for the examination and also answering the questions, because, you carry marks even in answering the questions. If you
The
forget to
more
examine
questions you'll
something,
answer, the more
the
points
more
you'll get.
max,
Yes.
exactly. And if you forget something, suppose you did not do that, you could just be like, to conclude my examination, I would like to examine this, and then you could be like, because of lack of time I did not do this,
They
just be
they
a bit tricky
understand.
but
They
answer.
understand. Yeah.
Yeah, they will understand that because of that you could not do it. But until otherwise, you are good to go, inshallah. Don't worry.
Yeah,
You are
definitely.
confident. You can do it, inshallah.
Inshallah. Only my question is, so whatever examination, let's say I'm not able to do, I shouldn't be just assuming that this could be the finding and just present it in my case. I can only
Yes,
say, yeah,
it
because
will be
otherwise it will,
given.
yeah, it will be like I have just memorized all the findings. So if I couldn't describe the whole of the peripheral neuropathy, like you asked me what sensory loss would you have, I wouldn't mention it in my presenting when I'm presenting the case, isn't it?
Not yourself, but
Yeah,
once
because I
they
have not
ask,
checked
then
it.
you should.
Yeah, okay. I can
But
only
it will
present
be
until
given
I've seen
something
it.
in the stem very clearly.
So we can
Dr.
mention it if
Mavish,
it
it
is
will
in the
be
SIM.
something will be definitely given. Yeah, in the stem, clearly it will be given. They write stems more clearer than I write.
No,
Okay.
because I'm saying if I'm describing and the bell rang and I have not got up to that step.
Yes. Then they'll ask you at the end the question, and then you should tell them
Okay, but when I'm
upon asking.
presenting it, I will only present up till I've described the examination. Like in my case, I've just reached up to the tone of the patient leg. I shouldn't
But
be
then you
adding
can
the
say,
coordination.
you can yourself say that I would like to complete
I
my
would like to. Okay,
examination with
yeah,
this.
yeah, okay,
Then they will understand. Okay, if she is
okay,
carrying it out these, then there must be some findings as well.
yeah, okay, yeah.
Dr. Mavish,
That's
for
fine.
this, I would like to give you a suggestion. Like after the bell rang, you will just start. Like I would like to complete my examination by doing this. Then you will have the summary, and at the last of the summary, you say, because of time, I couldn't finish my examination, but I would like to check these things. The examiner then may tell you the finding. Then you can say your
Yeah,
diagnosis.
I got it now. Yeah.
Yes,
Yes,
Dr.
just
Abhishek is
like
right. You
normal
could follow
practical.
that.
What is happening? Yeah.
Okay. Yeah.